My name is David Hicks, and I'm a Vice President at Fleetridge Pacific. And I do have a strong interest in selling medical practices because prior to joining Fleetridge, I was a clinically practicing physician, and I had a practice of my own which I sold. So I've been through the process before, and I think that, combined with my knowledge of clinical medicine, would allow me to do a good job of leading a Fleetridge team in representing our physician clients when they sell their own practices. Also, prior to medical school, I worked for a large investment bank in New York City in their high-tech mergers and acquisitions team. And I've been doing several deals with Fleetridge also for not only medical practices, but other healthcare providers. So combining all that experience in finance with my clinical experience, I think is a pretty potent background for helping our physician clients as they sell their practices. Well, the process really begins, I think, with determining if it's the best time to sell a practice. And so when we have a new client, a new physician client who wants to sell his or her practice, we talk a lot about whether it is the right time. We need to decide if it's possible that future growth of the practice could lead to a better valuation. We would want to make sure that the business is maximized in the sense to be sold. That is the coding maximized for revenues? Would it be better to convert to electronic health records? Would it be better to make sure key staff members are in place or that cuts need to be made in the staff? Are the payer contracts all current? So those are some of the features of a practice that we would discuss with our new clients. We also would want to review with our physician clients the goals of the sale and their reasons for wanting to sell the practice to make sure that it really is the right time for each individual client. We would want to make sure that our clients have a plan for a transition immediately after the sale, and also make sure that our physician clients will have employment after the sale, if that's what they want to do and they're not seeking retirement. But our physician clients may want to continue with their practices after the sale as employees. They may want to move on to other employment. So we need to review all of those features of the sale prior to taking a practice to market. Well, the determination of a value for a medical practice, I think, is a lot like the valuation of the other companies that we represent. It can be a fairly complex process, and it can be based on parameters on the income statement and cash flow statement, like adjusted cash flow or revenues. There are also some more complicated ways of doing it, like discounted cash flow analyses. But the point is that there are many ways to arrive at a value for a medical practice. Of course, we always like to stress the positive features of the practices of our clients to advocate for the highest value. We might look at and focus on things like multiple referral sources. We would focus on the quality of the ancillary staff of our clients. Do they have many mid-level practitioners and other physician extenders? We would want to stress the efficient management of costs for our physician clients. We would stress the strong reputation and goodwill of the practice. We would want to stress a good mix of payers, a strong reimbursement climate, a good assortment of fixed assets for the practice. And in focusing on all of those strengths, the valuation would be maximized. But we do not bring practices to the market with a fixed value associated with them. We like to let the buyers determine the valuation process because ultimately a practice is really worth what buyers are willing to pay. Each buyer might have their own preferred valuation method, whether it's based on cash flow or revenues or discounted cash flow. We also want to make sure that by not setting a fixed price, we are encouraging the largest number of potential buyers. And we also don't want to set a price that's too low because that might be leaving money on the table that could be realized by our physician clients. So we don't go to the market with a fixed price for each practice. To find buyers for our physician practices, we first look at the database that Fleetridge Pacific has. Unfortunately, it's a very extensive one. We also market practices more generally on our website and through some other marketing pathways. But by doing so, we are very often successful at bringing multiple potential buyers to each transaction. And we feel that's very helpful to maximize value. We like to get buyers to submit offers in writing so we can use those as a very concrete way to begin negotiations. Buyers for physician practices can include any number of organizations, from local hospitals, local competing practices and medical groups, and even very large hospital systems. We have an informal bidding process, which means that we don't have a set time by which the bidding must conclude, but we like to welcome buyers to come in over time so we can maximize that number. We also work very closely with our clients to facilitate the due diligence process and the negotiation of the purchase agreement. So we make sure that the process is as smooth and as easy as it can possibly be. Fleetridge fortunately has quite a lot of experience in selling not just physician practices but also other healthcare provider businesses. Over the last 9 years, Fleetridge has closed over 50 transactions, and not just for physician practices but also home health agencies and hospice agencies and so on. So I think all of that experience comes together well in how we represent our clients now. So we feel that we have a very good understanding of how to achieve the goals of our clients and to overall get transactions closed.